Hey, it's Roberto Miki again, and we've got another great hand question of the week. It's number 33 in our series of questions for medical students, residents, and fellows studying for the boards or in-training exams. Well, let's get right into it. It's a congenital hand question. Which congenital hand variation is depicted in the photo? A. Camptodactyly, B. Clinodactyly, C. Syndactyly, D. Symbrachydactyly, or E. Brachydactyly. Well, here's your chance to pause the video so you can think about the question and answer it. The photo depicted in the question is a clinical photograph of Clinodactyly. Clinodactyly is a variation where the small finger is angulated in the plane of the palm toward the ring finger. Now, Camptodactyly is a congenital contracture of the PIP joint, usually of the small finger, and Syndactyly is a fusing of the two fingers, and Brachydactyly and Symbrachydactyly are shortening of the finger, with Symbrachydactyly also having some syndactyly as well. Don't worry if you didn't get this one. In future questions, we're going to include some other congenital hand variations so that you can become more familiar with what those look like as well. Well, the answer to our question is B, Clinodactyly. Well, I hope you liked the video, hope you learned something, and we'll see you at the next one. Remember to like and subscribe so that you can continue to support this channel.